Emergency dentist, Kennewick, Washington. Need an emergency dentist in Kennewick, Washington? Call Emergency Dentist Kennewick, WA today, 509-591-0479. There are two primary reasons we see for requiring an emergency dentist call or visit. Number one, accidents are responsible for most emergency dentist visits involving a lost tooth or teeth, an avulsed, partially knocked out tooth, teeth fractures or chips, and even lost crowns. Sports play a dominant role in this, as does auto accidents. Teeth aren't very forgiving when they meet a steering wheel or the elbow or head of an opponent in sports activities. If you have been in an auto accident, particularly involving head injuries, be sure and be checked out by a hospital first. Number two, poor dental hygiene plays a role in other emergency dentist visits we see. Things like severe toothaches, painful to chew, painful and swollen gums, and abscesses from ignoring the dentist for too long. Poor dental hygiene sets you up for an emergency dentist visit somewhere down the road if you aren't taking proper care of your teeth with good oral hygiene. Typical emergency dentist problems requiring an emergency dentist, Kennewick, Washington. Call us immediately for the following emergency dentist, Kennewick, Washington issues: severe toothache, tooth knocked out, broken or loose braces, chipped, broken teeth, lost filling or crown, tooth loose, abscess, or gum, tongue, or cheek injuries. Emergency dentist, Kennewick, Washington, swollen face and pain. A serious dental infection that needs immediate response is a typical cause of this. Typically, these types of conditions don't get better on their own. It could be an infected tooth, bone infection, or gum infection. What should you do? Don't wait. It is imperative you get immediate attention. Call us immediately. If you delay, it is actually possible to die from an infection in or around the mouth. Sepsis. Stay upright and don't lie flat, even during sleep. Drink fluids. Getting dehydrated while you have an infection could make complications more likely. Emergency dentist, Kennewick, Washington, chipped or broken tooth. Typically, if it's a small crack, you'll need a filling, and if it's a large piece, you'll need a crown. If the tooth is cracked all the way through, that would call for a tooth extraction and need for an implant. What should you do? Don't panic. If you're not in pain, that buys you a lot of time. Most often, teeth will break and there's no pain. It's normal for there to be, at least initially, some sensitivity to cold and heat. All that means is that the piece that broke off was large enough to expose the inner structure of the tooth called dentin. This sensitivity will go away in a few hours to a few days. The saliva will remineralize and insulate that area. Give us a call. We'll get back to you right away with your best options. Emergency dentist, Kennewick, Washington, knocked out tooth. If you lose a tooth, in all probability, you'll need a dental implant. An implant fills the space where the root used to be in the gum. If you are able to reimplant the tooth within the hour, meaning stick it back in, there's a good chance that it will take. If the tooth is reimplanted properly, there's still a likelihood that you'll need a root canal, but at least you'll have your own tooth and won't need an implant. What should you do? Pick up your tooth by the crown, not the root. Touching the root damages the tissue that helps with reimplantation. Call emergency dentist, Kennewick, Washington immediately and let us know you have lost a tooth. Time is of the essence here. You have about an hour to get the tooth reinserted in order to save it. Put your tooth in a container of milk and bring it with you to the dentist office. Emergency dentist, Kennewick, Washington, tooth abscesses. Think you have a tooth abscess? It's hard to know whether you have a pulpal, the inner substance of the tooth abscess, without an x-ray and an exam. But if the tooth has lingering sensitivity to hot and cold, severe tenderness upon chewing, pain after positional movement, or is causing spontaneous pain, chances are good you have a dead or dying tooth. A pulpal abscess is an infection inside of the tooth and typically means the living tissue inside the tooth is necrosing, slowly dying, and will need a root canal to get rid of the dead and dying tissue. What should you do? Call us and make an appointment for the next day or as soon as possible. Need an emergency dentist, Kennewick, Washington? Looking for an emergency dentist, Kennewick, Washington? Call your emergency dentist, Kennewick, Washington specialist today. 509-591-0479 or visit us online, http://dentalimplants.kennewickwashington.com.